Oh, takes a minute. I'll let you know when it starts.
Looks like just said live, at least on our end.
Yep, I think we're all set. YouTube just came up on my screen, so I think we are good.
Wonderful. So with that, kick it off and welcome everyone to our afternoon meeting of the Commission to develop a paid family and medical leaves benefit program. Welcome back for our first meeting of 2022. And before we get started, we're going to do introductions. Up first, I will introduce my wonderful House Chair.
Good afternoon. I'm used to saying good morning to this group, but it's an afternoon today. I am Kristen Cloutier. I represent House District 60, which is part of my hometown of Lewiston.
Thank you. And Representative Stearns.
Good afternoon. My name is Paul Stearns. I live in Guilford and represent House District 119, which consists of 12 towns in the unorganized territories of Piscataquis County.
And Commissioner Fortman.
I'm Laura Fortman. I'm the Commissioner of the Maine Department of Labor. Happy to be here. Thank you.
And Wendy Estabrook.
I am Wendy Estabrook. I'm the Director of HR Shared Services for LL Bean, representing a large employer.
And Barbara Crowley.
Hello, I'm Barbara Crowley, a pediatrician and administrator at Maine General, representing children and mothers.
And Charlie Mitchell.
Charlie Mitchell. I own Bayside Bowl in Portland, Maine. I'm here as a representative of the hospitality industry.
And Emily Ingerson.
I'm Emily Ingerson. I own Ginger Hill Design and Build, and I'm a small business representative.
And Sarah Bryden.
Hi, good afternoon. My name is Sarah Bryden. My professional expertise is in the area of leave and paid leave compliance.
And Drew Christopher Joy.
Hey everyone, Drew Christopher Joy, based in Partner, Portland, and with the Southern Maine Workers Center. And I'm a representative of workers and self-employed folks.
And I am Senator Maddie Daughtry, and I represent Senate District 24, which are the communities of Brunswick, Harpswell, North Yarmouth, Freeport, and Pownell. Just a little quick housekeeping. We are streaming live on YouTube as always, and we are being ably assisted by the wonderful Colleen McCarthy-Reed and the wonderful Anna Broom. We also do have our website for the Commission. So if you're watching and you're looking for some of the materials that we're discussing, these are available on the Commission's website, hosted on our maine.gov site as well. Also, just want to let folks know, for those legislators on the committee, we are now back in the full swing of things. So you may see some people popping in and out. Committees are meeting and bills are being presented. So a few of us might have to come and go. So just want to flag that for everyone. But we have some pretty weighty and meaty things to go over this afternoon. Up first, we're going to review the survey results. And then we're going to jump into the discussion recommendations that we'd like to put forward to be referred to our actuarial study, and a little bit about vendors for that as well. And then we'll be discussing our report back to the legislature's Labor and Housing Committee. So that's some pretty big ticket items to go over this afternoon. But at first, I will kick it over to Colleen to help us review the survey results.
Sure, thanks. I'm going to pull up the survey. I think I'll start with the employee survey. Sort of the analysis of the data is very unscientific. As you know, that the survey itself was sort of an unscientific survey that we posted through Google, but I think we did get fairly robust response. We had over 700 responses to the employee survey and about a little over 75 to the employer survey. So I did try to pull together the slides that Google assists us with to sort of compile some of the results for you, and we can go over those. And then I did also share with all of you sort of the unedited kind of comments that we received in response to the open-ended questions that we included for each of those two surveys. So I'll pull this up quickly, and I apologize. I know I shared this late on Friday, but when we closed the survey, it took a little time to get pull this stuff together. So I'm just going to try to make it as big as I can. So as I said, we had 731 total responses, although not everybody answered each of the questions, and we allowed that as sort of how we set up the survey. But just to kind of, I'll just go through this quickly and highlight for you close to 60% of those who responded to the survey were in the age bracket between 25 and 44. So you can see the 36% were in that 35 to 44 age bracket, and 31% were in the 25 to 34% age bracket. So fairly representative of sort of folks who may be starting families, taking care of parents, as we've talked about before, as we've talked about some of these questions moving forward. In terms of the racial question, I don't think there's any surprise given our demographics in Maine that the vast majority, almost everyone who responded, indicated that their race was white. In terms of county, I think I skipped over, sorry. I think I'm out of order in the slides here, but in terms of the questions. In terms of where folks live, we got responses from every county in Maine, although some counties were very small. So you'll see Piscataquis County, I think, in terms of the data, it says 0%, but I think there were 3 responses from folks from Piscataquis County, for instance. But a majority, 50%, were from Cumberland County. The second largest respondent group was from York County with 11%. In terms of gender, this was an open-ended question. So for purposes of sort of Google, they included all of this in sort of the bar chart graph, but 53% of those folks who responded, or more than half, were female. In terms of the way that folks work, surprising to me, I think that most of the almost 70% of the folks who responded to the survey indicated that they were full-time employees. So you can see the rest there as well, but that was a surprise to me, I think. In terms of earnings, this was really split as well in terms of where folks indicated what their earnings were from work. I think 12.9% indicated that they had earnings below 20,000. The next 2 largest groups were those in the 30 to 39,000 range, and the 40 to 50,000 range. But they really kind of, you had folks responding from each of the income brackets that you included on your survey. This was a duplicate. Again, trying to get this out to you quickly. So I apologize for that mistake. In terms of the question about how many members are there in your household, 33% of those who responded to the survey indicated that they were two-person households, and then you had 24% responding. The rest of them responded with additional members of their household. I think if you only had 9.2% of those responding that said they were just a 1-person household, which I think indicates that folks who are responding have family members. In terms of how many other members of the household were working other than the person responding to the survey, 66.7% responded that one other person was working in their household. In terms of the question that you asked, whether or not the folks responding had access to paid time off for family and medical leave at their job, this was a fairly close split. 50% roughly responded that they did have access to some paid time off for family and medical leave. 43.3% responded that they did not. In response to the question about paid time off being a factor that someone would consider in either accepting a job or deciding where to live. 88.5% of those responding answered yes to that question. And I'll note that on each of these slides, I did include how many responses you got to each of the questions. So you can see most of the folks have been, responded to these quick questions. You had less folks responding to the questions that had that were more open-ended. And for the question that you asked for about whether or not or how much folks would be willing to contribute from their wages to provide funding for paid family medical leave benefits program. This again, I think was kind of, you had folks responding in all of the categories. 24.2% indicated that they'd be willing to contribute between $10 and $13 per week, which again, we picked these numbers based on sort of the contribution levels required in other states. And there were some states on this higher end of contribution levels. 25% indicated they were unsure of an amount, but willing to contribute. And then in the middle there, you'll see 24.3% and 21.1% indicated that they were willing to contribute between $1 and $10 per week. These next set of questions really related to asking folks about the life events that they have experienced in the past. And this is a little bit of a messy slide because of the length of the question, but 58.9% indicated that they have had to deal with a situation where a close family member has been seriously ill. The next question related to family members being in the military, being deployed. Folks, 23% responded that they themselves have had an accident or a serious illness that they needed to take time off for. 49.8% said they needed surgery and had to take time off for that. 42.5% indicated that they've been sick and needed time off. 54.6% indicated that they've given birth. So you can see the respondents really indicated that they would use paid family and medical leave both to take care of themselves, but also to take care of their family members. And then this question really dealt with how they've handled those life events in terms of their work experience. 11.1% indicated that they did not take time away from work. 6.4% said they didn't take time from work because they didn't have access to paid leave. 63.1% said they took time away from work. I just want to make sure I'm answering the question correctly. Sorry about that. Go back to my survey. Are you back to seeing my survey? I was just clicking over to another.
You can see it. Let's see.
Can you see the survey?
You can see that we're on question 13. It says.
Oh, okay, still. Okay. I just clicked over to something else and I didn't know if I got you out of the stop sharing. I don't often do that, go between two different documents.
Right.
And then these last three questions really are the ones about folks who are able to take time away from work. And you can see those responses. And I can pull up the questions because these are a little messy to see in the responses. If you want to delve into these more deeply as we get into the discussion, I can pull up both the question and the chart. And then in terms of asking folks what types of events they might think will happen to them in the next 2 years and when they might need to take time off, the vast majority of folks indicated that they thought they would have to take time off to take care of a close family member. 38.9% indicated that they believe they'd need surgery or have to take time off related to their own illness, and 32.9% indicated they were expecting to start or expand their family. And then this was the last question that has a graph talking about how they think they would handle that need to take time off from work. 3.9% indicated they wouldn't take time off. 30.3% said it would be helpful to take time off from work, but they thought that they would keep working. 58.5% indicated to that question that they'd take time off from work, but not as much as they really needed. 15.3% answered that question as saying that they would take all the time away from work that they needed and that they would be paid. And then correspondingly, another 15.8% responded that they would take all the time they needed, but it would be unpaid leave. Oh, and then we did ask one more question here on the chart about what amount of wage replacement folks believed they would need if they did take paid family and medical leave. 44.8% indicated in answer to that question that they would need 100% of wages. The next category, the next highest percentage category was 21.4% indicated 80% of weekly wages. And then again, I just noted that I did provide for you a link to all of the unedited responses where folks were able to provide comments to you about the life events that they've experienced and sort of sharing their experiences. So you did have folks responding, a number of folks did respond to these questions that were more open-ended about their own experience that required them to take leave, what experience they had with their employer. I don't think I'll go through all of those, but we were able to compile all of those for you for your review. Do you want to stop or keep going through the employer survey, Senator Daughtry? What do you think the best?
Does anyone have any
way to
questions?
do it is?
Or okay, I think let's just jump right into the employer one.
Okay, I'll go back into this one.
I will say while you're pulling it up, if folks haven't had a chance to read through the sort of free responses on both the employee and employer, there were a lot of really helpful points that hadn't been brought up. I know they're just individual anecdotes, but they really helped me sort of put it in a really good, realistic spin of what we're dealing with right now. So,
yeah, one of the things I should note is that one of the questions that was open-ended that you may want to take a look at the employee survey results from was how much time they thought they would need, or, and it really ran the gamut, but you can see folks, some folks indicated, a short amount of time, other folks indicated a larger amount of time. And one of the things that Ann and I really didn't have a chance to do was to try to delve into those responses and kind of collate them to give you a sense of where folks ran on that. But if we would like to kind of take a look at that, and we may be able to quantify sort of what amount of time or where folks fell on that spectrum. So that's another question that's in there in terms of, besides the ones that sort of sharing their individual experiences. I forgot to note that as I was going through.
Thank you.
So in terms of the employer survey, as I mentioned, we had 77 responses that we received to the survey from employers. 93.4% of those who responded said they were had employees. There were a few that were self-employed, that self-identified as self-employers. And you can see we really had a range of employers responding in terms of the number of employees that they had. 19.7% of those who answered the survey had 100 or more employees. 9.2% had 5 to 9. 25% were the really small employers. So you can see it really ranged in terms of the responses that you got. So you did get, I think if you do go through some of the comments, you can probably pick out sort of the comments that you received from those very small employers to those who had a larger number of employees. The majority of respondents to the survey were from Cumberland County. And then the next were from York County, which I think tracks the results of the employee survey as well. In terms of the question about whether or not the employer currently provides access to paid time off for family medical leave, 56.6% answered that question yes, 43.4% answered no. And I think if you look at the comments, you'll see a number of the employers referenced Maine's existing law for paid, earned paid time off. And that may be what they're referring to when they're answering that question, yes. We didn't delve deeper to find out if it was, specifically for family and medical leave or just sort of the general complying with the Maine state law that's in place now that allows employees to earn paid time off and take it. We did ask employers if they currently provide paid time off for family medical leave, the factors for why they did. We got 45 responses to those questions. I did provide all of those unedited responses, but it was easier to kind of pick out kind of common themes for 45 responses as opposed to 300. So we did highlight a few here on this slide. You had a number of commenters saying they felt it was the right thing to do. It would help attract and retain employees. It's inevitable that folks would need time off to care for someone, and they valued a workplace that would support their workers to do that. They believed it was best for employees to be paid when needing time off. And again, as I mentioned, earned paid leave now required under Maine law. So that was a comment that was provided by a number of the employers, indicating that paid time off now can be used for any reason. We also asked employers that don't provide paid time off for their workers for family and medical leave to describe the factors for why they do not. And we had 47 responses there. And again, some of the comments were similar. They thought they were too small of a business, and the current minimum wage and paid time off policies are already putting a strain on their business. A number of commenters indicated that they couldn't currently afford it since they were still in a startup phase. It would be difficult to keep the business going financially and staffing wise if employees were taking paid time off. And you did have a number, as if you look through the comments, I think you received a number of employers who were child care providers answering the survey, and a number of those noted the current staff-child ratios and that it would be difficult to meet those and pay folks both to cover that and also to pay for the substitutes for those to meet those ratios, substitute employees. You also asked a question about whether or not they would use paid time off for family medical leave as a recruitment and retention tool. 53.4% answered that question yes. And then this was a question about the different types of life events the employees have had to deal with. And you can see 65.3% indicated that employees have needed time off to take care of family members. 48.6% their employees had an accident and needed time off. 66.7% was a question related to an employee needing surgery, and 75% said their employees have needed paid time off because they've been sick. The next largest category, as I think you can expect, is employees that have had children. And then you asked a question as from the employer perspective, how they handled those life events for their employees. 13.6% indicated that they were unable to provide the employee time away from work. 45.5% indicated that the employee was able to take unpaid time. 31.8% indicated that the employee was able to take some period of unpaid time away from work, but not as much as the employee would have liked. 47% indicated that the employee was able to take time away from work that was paid. Some portion of it was paid. And 31.8% did answer that question, that 31.8% that their employee left employment to address that life event, or have had an employee that has left their employment to address that life event. And then in terms of sort of additional comments about how employers have addressed these situations and how it's affected their business. This is a sample of the comments again, and we did provide all of the unedited responses. Folks believe that it's a positive for their employees to be able to take care for themselves and their families. Several employers indicated the challenge when employees need a longer term leave in terms of dealing with it financially, but also from a staffing perspective. And the potential hardship that might cause for the other employees who have to pick up the slack. Other employers indicated their policy has been to allow unpaid leave and protect their job, and wish that they could provide paid time off. And then this last question relates to the willingness of an employer to provide a contribution to help support a paid family and leave program. 38.4% responded to that question that they were not willing to contribute. 32.9%, however, said they were unsure of the amount but willing to contribute. 11% said they would be willing to contribute up to 50% if the employees paid the other 50%, and 17.8% indicated they would be willing to contribute more than 50% up to 100% on behalf of their employees. So again, I think I'll stop there. But we did share with you as well the all of the sort of comments or that were provided to the employer survey. I'm happy to go back and pull up any of these. I can also share, if anybody's interested, we have a spreadsheet that downloaded all the responses. If anybody wants the raw data, we're happy to share that.
Thank you so much, Colleen. And is this available on the commission website as well? Oh, you're on mute.
Yep. They were posted this morning. So folks listening, and I did send out the link to the interested parties list before the meeting. So if anybody's listening, they should be able to access the survey slides, and then also the all of the sort of the unedited responses to those open-ended questions as well.
Perfect. Thank you so much for all of your work on this, both to you and Anna for getting this together. And I know it was a little bit of, unsure of what we get, and really want to thank anyone who's watching who is able to fill it out on either the employee or the employer survey. We got a pretty robust amount of responses. I'm pretty impressed by how many people took the time. So thank you. Do we have any questions, comments on the survey results? Not seeing any. I think, that sets the stage to sort of jump into the next big portion of our agenda, really getting into the meat and potatoes of our conversation, sort of the discussion and recommendations that we want to refer over to our actuarial study. Just to let the commission know, the subcommittee, we have been asking for recommendations. We've sent out, I don't know, Colleen, if you want to give a quick overview real quick on the actuarial study of the responses received.
I'm happy to. And I actually got one update since even I sent out one additional folks responding with some interest, additional interest around noontime. But we developed sort of a list of potential consultants that were recommended to some of the commission members, and also we reached out to some of the other states that had made presentations to us before. at your earlier meetings for contact information for some of the consultants that had worked for them. So we reached out to, I think, 8 consultants total. We received, I would characterize, we received interest or strong interest from really 2 consultants who have done work for other states, Spring Consulting Group, and also Wild Fig Partners, which has worked with some other states on their feasibility studies. Milliman, which is a sort of a nationally known consulting group, expressed interest in bidding on the opportunity and was working to identify sort of their in-house expertise. And I actually received an email back from them over the noon hour that their person who has the most experience within Milliman actually works out of the Portland office. So they would be interested in talking with you further and potentially submitting a proposal to the committee, as did Oliver Wyman Consulting. And they wanted to ask some additional questions and wanted to follow up, and was sort of in the process of pulling together their sort of work plan for the year, and hope to have further discussions. The committee, the actuarial subcommittee, also reached out to the Public Policy Center, the Nelson Rockefeller Center at Dartmouth College, which had done some work for the New Hampshire legislature on a feasibility study. And they responded that they don't have any sort of actuarial expertise. It was done more as a student-led project on a pro bono basis for New Hampshire, and they've also done some work for the Vermont legislature. But if the commission was interested, they may be able to do a meta-analysis, really looking at all of the feasibility studies done to date in other states, if that might be of interest as a complement to a specific actuarial study that the commission might do. So that may be something you want to discuss further and take advantage of.
Indicate they'd be willing to do that at pro bono as well?
I think so, but they were hoping to sort of have some further discussion. And given that that's, their public policy school, that may be something that, Muskie School or something, might be interested in doing as well, potentially, because we did not reach out to the University of Maine system, because we didn't think that they would have we're not aware that they would have the expertise. And we also realized that they were in the process of working with the legislature on some other projects right now. And then there were some additional consultants that we reached out to that actually declined the committee's opportunity or invitation, because they felt like they didn't have the expertise in paid family and medical leave issues. One was Wakely Consulting. One was Gorman Consulting, and these are some consulting firms that have done work for the Bureau of Insurance and in the past. And we also heard back from Barry Dunn just this morning as well, that they do not believe that they have the in-house expertise on these issues. They're more focused in the healthcare area, and declined the opportunity. But Barry Dunn did indicate a willingness to sort of help the commission identify potential consultants if you needed that. So that's the update on the folks that we have reached out to. And then I guess the next step for you is to really try to, I think, narrow down or outline a framework for an actuarial study. And then the commission or the subcommittee could follow up with some of these, talk about some of these potential consultants, and then follow up with them to get a study in the works.
Thank you so much. And I love that idea of sort of having the meta-analysis of the other feasibility studies sort of as a complementary resource for us with the actuarial study. And thank you for that overview. And for commission members, just, sort of a reminder of next steps. I think for us, the conversation we're having today is what we as a subcommittee can wrap up to have, these folks look at and bid to get a better scope of work when they're going forward with this. And the one thing I definitely want to make clear, not only to all of us, but anyone watching, the purpose of today is not to come out with one set of recommendations. This is almost sort of, if like you're writing your business plan or your thesis proposal and you're looking at a bunch of different, or even making your grocery budget and you're trying to figure out how much everything is going to cost, this is our opportunity to put a couple of requests forward and then be able to compare and contrast about what the cost would be to, Mainers, to the state, and go there. So, if there's an area where, we have, everyone's like, yes, we agree on this, awesome, we'll put that down as one clear recommendation. But if there are other areas where, one, we're not entirely sure and we'd like to see a range of options, or maybe we have a couple of different folks who'd like to see the different costs, please know that the goal is to come up with a bunch of different ideas so that we can feel out this. It's not about coming up with the total plan right now. It's also a lot of, for me, when I was going through the resources, that soul searching of what do we really still not know? And what do we really need to get more concrete, local data on as well. So I think, I don't know, Representative Cloutier, would you like to say anything before we jump in on reviewing on the questions?
No, I'm ready to just jump in.
Okay, so if everyone can pull up your list of questions that you got with the packet from Colleen, and I think we're gonna jump right in unless anyone have any questions before we get started. Not seeing it. This feels kind of reminds me of like, when you're doing your like pop quiz or doing something like that in school. So up first, let's talk about what purposes can leave be used for. Anyone? I'm loving the blank Zoom faces.
So for me, and maybe I shouldn't be the first one kind of jumping in here as a chair, but this feels like one where I really sort of want the broadest range. So, childbirth, foster parenting, domestic violence situations, to care for a family member, but also someone who has a family-like relationship. I'm sure I'm forgetting things, but those are the things that come to the top of my mind.
Agreed. And I do think we saw when we first did our framework, if you look back on that from all the commission members, there were a lot of, I think, similarities on there. And did you mention military deployment? I can't remember.
I did not, but that is, yes, also very important.
I'll just add there, the military deployment leave would definitely like to see. Barbara, and then Commissioner Fortman.
Well, I think I'm still in the same place I was in when we answered these questions before we had as much education as we've had at this point. And I would say, as a member of the subcommittee on the looking at the actuaries, well, we intend to get some responses, and it's nice that we have 4. We really probably only want, in the end, probably 2 to come and do a more extensive presentation. But part of what I think we want to see when we present this is, what is the range of costs based on what we decide to put forward here? So I'm still in a place where I want to put the broadest possibility, not because I expect we're going to get all that, because I'm not sure we are, but because I want to understand what the financial impact is going to be on employees and potentially on employers. So I would have us go through all the bonding, significant illness and injury. And frankly, I think we're going to have to really work at defining what a significant illness and injury is. End of life care, military deployment, domestic violence, all of those to be part of this. But I think we're going to want the actuaries to tell us what each block costs us. Okay.
That's a really good reminder, and kind of where my mind was at, but couldn't quite sort of structure it. That sort of, I don't want to say a la carte, but being able to see what each sort of chunk would be. And I wonder if we could model it off after the other states that we saw, to be able to have all of those and be like, safe leave is going to cost X amount, or military deployment is going to cost this much more, and go from there. Commissioner Fortman? Oh, okay. Then I had Representative Stearns and then Sarah.
Thanks, Maddie. One that's churned around in my head is time for mental illness. mental health.
Yeah.
And that's a real tough one because there's a lot of undiagnosed, real true mental health going on. And yet there are folks who are just having a little bit of stress in their life, in my opinion. And oh my goodness, I need mental health day to go do whatever. So that's a very tough one to quantify as rules get made. But boy, is it an important piece, as much so often as a physical ailment. So I don't know. I haven't helped. I've just tossed that out there.
That's a help. We want to toss everything at the board right now. And I don't know, Colleen and Anna, if this is something that's interesting. And this is where, I mean, Sarah, you might have an answer on this, of existing federal family medical leave that allows, yeah, I'm seeing nodding, so I'll just kick it right over to Sarah.
No, and so actually it's it's good timing. So I did the raise my hand thing anyway, to say that from the lens of trying to achieve simplicity, which we've talked about in several of these meetings, one way to achieve that would be to align the purposes or the leave reasons with federal FMLA. That also gets to what Representative Stearns and Dr. Crowley were talking about in terms of how do we define, what gets covered in terms of a medical condition or a mental health situation. There are definitions existing that are very well known, well accepted, that we could leverage. And in terms of the conversation around which family members, what we could do, one path forward would be to say, track along with all the leave reasons in federal FMLA. And then when you get to the point of defining family members, that's where you might want to, open the door a little bit more.
No, that definitely makes sense. Anyone have anything to add on that? Wendy?
Just as a reminder, when people apply for a leave, they are required to provide documentation. So I completely agree with Sarah's recommendation to start with the FMLA, for instance, for those definitions. But just as a reminder, people don't get to self-diagnose necessarily. They do have to present documentation in order to be eligible. So there is that removal of that for any individual to determine their own situation.
That's a good reminder, Wendy. So I think maybe what I'll rephrase the question as, is there anything outside of the existing federal FMLA that we would like the actuarial study to look at to be covered in here, that we could have, the FMLA, lining up with, that with the federal standard? Is there anything above and beyond that any of the commission members are interested in having examined? Drew Christopher?
I feel like I'm not familiar enough with what's in the federal to be able to say like, oh, that sounds right to me. And I appreciate the reasons for it, but I feel like I would want to look at it to see if it aligns with all the things that I think should be in there. I also just wanted to name, I think that I don't know if it's in the FMLA, but elsewhere, the federal government actually has a very inclusive definition of family. And so it might be useful to look at that. I actually have concerns still about the proposal around that that's been put forward from some of our allies.
Absolutely. And actually, Sarah, I'll kick it right over to you.
Yeah, I was just going to say that federal FMLA covers an employee's serious health condition, care of a family member with a serious health condition, bonding with a child that's been added to your family, leave for a service member who's been injured or is ill because of their service, and a very special fun category called qualifying exigency, which has to do with when a family member has been deployed and the employee needs to deal with situations that are related to that. So domestic violence and related absences would not be part of that. So if we want to get an actuarial review of that, that would be separate.
I would add, this is where, the fun part of being both a chair and participant, what I was going to say that I'd like to have looked at to bring up for the committee is safe leave in addition to federal FMLA. Drew Christopher, to kick it back to you.
Oh, I agree with that.
Perfect. Emily?
Yeah, I agree also safe leave, but I believe, some of the other states and other conversations we've had mentioned bereavement as well. So if we could include that, maybe a shorter time period or something like that, but I think that's important to look at as part of this.
That's an important reminder. Sarah?
Sorry, I'm just going to keep raising my hand. So I was going to say that other jurisdictions have approached bereavement in a slightly different way. There are some states and some jurisdictions that essentially say, for the purposes of bereavement, the requirement is that the employer must continue to pay the employee. So it's not out of a fund. It's not a risk pool sort of conversation. It's just, you know, if your child dies, then your employer has to pay you for a certain number of days. And in terms of simplicity and trying to create a set of recommendations where all the leave reasons are part of one big bucket of time, that might address that particular nuance.
Yeah, and as a reminder, we saw in some of the other states that certain categories had certain amount of leave that, you know, was not the same as other items.
Right, and I guess what I was trying to say is that gets very messy.
Yes.
So.
As mud. Wendy, did you have your hand up?
I was actually just going to ask that clarifying question of Sarah, but then you answered it. Thank you.
Of course. Actually, a housekeeping question for Colleen and Anna. For any of these recommendations, because we're a commission and not a committee, do we need to do a formal vote, or how does this work? I just realized, you know, you're authorizing legislation, but it doesn't say anything about, you know, joint commission rules or.
Right. I mean, I think it's really up to you. I mean, if you wanted to follow sort of the committee rules and take for electronic meetings, at least, we've been doing, you know, you could just have folks indicate. Committee rules, I think, are stricter, requiring sort of a roll call. I don't know you necessarily have to do a roll call, but you could do some show of hands if you're comfortable, especially, I guess, if there's going to be some disagreement about any. If you're sort of building this through consensus, then you could just, you know, do it that way and have sort of one, you know, vote at the end, if you will. But I think you really have a lot of flexibility. There's no specific requirement necessarily for commission meetings about how you need to handle it. I don't think we need to go through a roll call. I'm happy to do that. We can definitely do that if you'd like to, but I don't think it's a requirement.
I'm also just thinking it's for us compiling it for you and Anna so that we have it, that it's, you know, nice and clean and neat for all of you.
Yeah.
Concerns?
I was just going to point out, we could even default back into unless, raise your hand if there are objections.
All right.
However, with that said, I think it's imperative that we have that asterisk qualifying statement on every one of these documents that at this point in time, we have to have a place that's quantifiable to give for the actuarial study. So it doesn't mean that individual members have signed on to each and every one of these. It just means that the idea isn't so egregious that I'm going to block it at this time. Does that make sense?
Yeah, we should put that literally as the header and the footer. I feel like
we need that qualifier because some of us might get crucified when we go out amongst the peoples.
Absolutely. And I feel like I got to find a new phrase other than beating a dead horse, because that just feels really unfair, especially when you're discussing paid family medical leave. But, you know, just for anyone watching, this is us looking at all possible things. These are not the set in stone recommendations. These are not, you know, echoing, you know, our own legislative priorities or those of Commissioner Portman's, or, you know, this is all of us working together to get answers to these questions. So absolutely agreed, Representative Stearns. And doing an unofficial straw poll, does everyone like Representative Stearns' idea of just raise your hand or speak out if there's an area of real big disagreement? Okay, I'm seeing nods, thumbs up. So on this question, what I'm sort of hearing is we would ask the actuarial study to look at the cost with the existing federal FMLA. My question real quick, not to put you on the spot, Sarah, but does mental health leave qualify under current FMLA? Okay, so then we wouldn't need to put that out through a separate area. So the only thing I've heard separate from the federal definition currently would be safe leave, correct? And Emily?
I mean, I do think we should explore bereavement, because just saying, well, we should just have employers pay people for bereavement leave may or may not work in Maine, given the number of small employers that we have. So I think it should be considered as part of the study.
So yeah, we could ask, I agree with that. So safe leave, bereavement. Anything else on there?
I have a quick question about those 2 additional leave reasons. Would we be asking for an actuarial review of the implications of having those additional leave reasons at the full amount of leave entitlement that we land on? So for example, if we say 12 weeks, would that be potential? I mean, not that anybody would necessarily, or not that folks would have a need for 12 weeks of safe leave, but allowing that, for the worst possible circumstances with documentation.
So I think this is sort of jumping ahead on a couple of questions, and please let me know if this doesn't make sense, but this is me trying to explain how it is in my head. Of what I would see is we're going to probably be asking actuarial study for a costed analysis of a couple of different time brackets.
Mm-hmm.
And so I think that would also fall. Like you could say we're looking at 10, 12, 24, literally just grabbing numbers out of random right here. And it would say for safe leave, it would be X amount to cover X amount of weeks. And for the full FMLA, it would be X amount for 12 and 24 weeks.
Mm-hmm.
Does that make sense?
Sure. Yeah, as long as we are being clear with what we're presenting.
Yeah.
I just want to make sure that either we're saying, all of these leave reasons for 12 weeks, or we're saying all these leave reasons for 12 weeks and these 2 for 4 weeks, or you would just that level of clarity.
Agreed. And I think unless I put it just in my own questions that are not on there, that was one of the conversations about what qualifies in there. And I think I had it under the time limit. So I think we'll get on to that.
Sounds great.
Before we move on, anything else on purposes it can be used for? Okay, and we can always circle back. So if you have a light bulb moment and you want to revisit something, please just shoot your hand up or jump right in. Okay, up next we have who is covered. Who wants to jump in there? Drew Christopher.
I'll say it over and over again. It should be universal, so all workers should be covered. There should be an opt-in for self-employed workers, and just making sure that we're including temp, per diem, part-time, all those kinds of folks that sometimes get pushed out.
Agreed. Any strong feelings otherwise? I think we've all been pretty clear from the beginning. We want to be as universal and accessible as possible. Representative Stern, Sarah, and then Commissioner Fortman.
I just want to make sure that we make sure that people are legally employed. Because if people aren't somewhere in the system and they're working under the table, I have an issue with that.
Yeah, I think this is not my area of expertise, so if someone else feel free to jump in here. The way that it gets submitted, except for on the self-employed portion, I think that's a little more tricky. You have to, it's coming through a payroll service, so you have to be pretty creative to make that work. So I'm going to just actually kick it over to Sarah before I talk about something I don't know about. So
what I was going to say is related to this. So I wanted to, I understand and I share the goal of getting as many folks covered as possible. There was a conversation, I think it was when Andrea Barton-Reeves was talking about the Connecticut program and the legislative issue that she was pointing out about folks being able to get benefits even though they hadn't contributed, or there was a conversation around that. So I wanted to make sure that the group did or did not want to have folks be covered under this under a proposed program by virtue of what they've paid into the fund, or what has been paid in on their behalf based on them having worked some amount of time.
that makes sense. Representative Stearns, did you have a follow-up or question on that?
A bit of a follow-up. I think that addresses my concern, because certainly self-employed is often a group that are left out of these type of things, and self-employed folks should be included. And if we elect to have a percentage, maybe 100%, of the cost shared by the employees, then a self-employed person could then obviously participate by joining in the program or choose not to. So I think that covers my question. Thank you.
Thank you, Sarah. I'm so glad you're here for this. Any other comments or questions, Sarah?
What I was going to just chime in with for an additional follow-up is really, it's around, should folks be able to submit a request for leave and get paid benefits on day one of employment? In terms of portability, that could be day one of employment with a new employer because they've worked for 10 years for some other employer, but they've paid into the fund. So it's that sort of conversation that we need to talk about.
Yeah, I have it under to do the unpaid waiting period about when you can take it. So I think that's definitely something we're in it.
Those are related. Yeah, they overlap a lot. Yeah,
I had it put in there. But yes, that is definitely a big issue about the portability and accessibility, and it could be day one for someone coming into a new job if it's covering on that level. I had Commissioner Fortman and then Emily.
So, and this gets back to our first conversation about different costs for different groups. And while everyone has really talked about universality and how that's a core principle, I also wonder if we should be looking at, since we're going to be looking at costs, if there are other cuts along there as well. So whether it's all employers or if it's something like the earned paid leave that we currently have, which is more than 10 employees, or if it's something, and I see Drew is saying no. And I'm not saying this is the policy, but I'm saying, should we know what the costs are at those different cost breaks?
Kind of, looking at all the different questions and thinking about asking, what is the cost for everyone?
Right.
What is the cost if we include anyone with a business of 25 employees or more? Or is it everyone except for public workers? Or is it be able to get the cost of the program that way? So totally understood and agreed, Commissioner Fortman. I think that is part of wanting to know the different costs. And first off, wanting to get that big universal number first and foremost. Emily and then Sarah.
Yeah, so I want to just reiterate that I think it's important that everyone is included, and I'm not sure how to make that happen because there are so many self-employed people who are not on payroll. So I think the mechanics of how that will work is something that will just need to be figured out, obviously. But that's I think probably a big chunk of people in the state. And also we need to think about seasonal workers, which is another large chunk of folks that I think should have access to these benefits, and kind of every category of worker possible being included, I think is really important. I also think the question of eligibility and sort of a waiting period is really important to make that as minimal as possible, because nobody planned, or many times, most of these events are not planned. And to say you can't access the leave because you've only been working here for 2 weeks or 3 weeks or whatever the case may be, I don't think that's fair. And I think it would disproportionately affect, women returning to the workforce after having children. And I think we need to consider that impact too, because if mainly women, but other parents as well, of course, it's often a factor of considering returning to the workforce in terms of whether they'll be able to access leave to have another child or not.
Definitely. And I think this might be another instance where Sarah is perfectly queued up after me. But I think one of the nice things of not being the first state to take this on is that we have really good models of how to calculate in either, seasonality, how do we count multiple incomes? We have other models of how self-employed people can opt in other states. So we can, look, the actuarial study is able to look at those and sort of get that mechanism. And I think that's going to be a huge help for us in this process. Sarah?
Yeah, so to that point, as an example, in California, the eligibility requirement is whether the employee has earned, I think it's whether they've paid in on a few $100s worth of earnings over a 4 calendar quarter period. So the bar is very, very low. It's, it's not a high bar in terms of how much have you earned and paid into the fund in the preceding chunk of time. But I brought it up to sort of have a conversation around whether it really should be day, it's your first job in the state of Maine, you've moved from another state, that sort of thing. The other thing I wanted to bring up in terms of very, very small employers, from a lot of the conversations we've had, it does feel like it would be a tough sell for this group to say, well, under 10 employees is not part of the pool. But there are other mechanisms that we could send to the actuaries. So, for example, I believe it's Washington State has a provision that says for very, very, very small employers, the requirement to contribute on behalf of your employees is different. If you choose to contribute on behalf of your employees, you can apply for funding to help cover the cost of temps when somebody goes out for a long time. So we could think about that and try to get a sense of actuarially what that might cost if we were to do it that way.
Definitely. And we heard not only other states present about it, but we also had some advocates. And I think honestly, actually, both the chamber and the Maine Women's Lobby and the Paid Family Leave Maine Coalition all brought up looking at a small business exemption for example. Especially when you're looking through the survey responses from the employers, I think we saw that loud and clear. So I do think there's other ways to make sure that everyone's in the pool, but that we're, acknowledging the financial hardships to make that work. So, which kind of, I'm looking at the questions that we have on our list and trying to think of sort of how to formulate this on recommendations. I'm wondering, first off, I'm going to sort of jump ahead because I think this is sort of a simpler yes or no question. Does anyone very passionately not want people who are self-employed involved in this? Okay, so can everyone give me a thumbs up if we want to say to the actuarial study we'd like to get a cost in self-employed? Okay, I am seeing widespread heads and nodding, so I'm just going to do one concrete one so we can say that we would like to have self-employed people. Drew Christopher?
I appreciated what Sarah was just bringing to the conversation about sort of alternative ways to support small businesses. My preference would be that we are really only looking at a universal system and that we look for some of the costs of ways to make that possible rather than ideas about how we look at costs to exclude people. Because I think it's from a worker perspective, I think exclusions are bad policy. They don't really make sense. They punish workers for where they work. And I think that I would like to see us commit to a universal program, but looking at some different ways that we can fund that more creatively.
I'm sorry, can I just ask a follow-up question to clarify with Drew Christopher? Were you talking about making sure that every employer, the employees who work for every employer, are covered and part of the program? Or were you also saying that you think every employee should be able to take leave on day one of their employment in the state of Maine?
Sorry, I think I was speaking specifically to making sure that any employee can be eligible regardless of where they look, and that we can look at other ways to make that more affordable for businesses of different sizes.
Makes sense. Thank you.
Thanks.
With that clarification, I think really we're looking at, sort of baseline, and then we have things up and down on the other questions is all of Maine, boom, workers. So that sort of feeds into the next one. We had Commissioner Fortman.
Sorry, I hear the argument, Drew Christopher, and I understand the desire for universality. And I understand the commitment to work toward that. I do not think that having information about costs prohibits a commitment to universality. I think it provides data so that decisions can be made. So what I'm saying about understanding the costs is not an argument against covering everyone. It is perhaps could strengthen the argument for covering everyone by knowing how much would it cost. And if that cost is very minimal, I think it strengthens the argument for making sure everyone is covered.
Thank you, Commissioner Fortman, for much more eloquently being able to say what I had tried to scribble out into a thought on the next page. I think if we look at sort of the next questions, it's exactly that, of trying to make sure that we have all of our ducks in the row to know the true cost, to be able to try to cover all Mainers. And on that, sort of skipping ahead, on the public sector workers, this was one thing. This is not my area of expertise. We have people on this call who are much more aware of these, but I was wondering what people would think of literally just asking the actuarial study of what's the cost for them being included and what's the cost of them not being included, instead of getting into a debate. You know, Representative Stearns knows far more about the negotiation contracts on this than I do, but if possible, that was kind of my thought of, could we just get one number with, one number without? Thoughts?
I really like that idea.
Representative Stearns?
I like the idea, and at some point, a line needs to be drawn in the sand that if those public groups are going to take part in this, if they have the option to do that, then they need to select one or the other, not continue along with their collective bargaining agreement and cherry pick from this. So that's a huge segment of employees. And my suspicion is that they will want to continue to collectively bargain their own lot in life. And as the private sector has things that are made available, and if some of those components are a little better than what's in their collective bargaining agreement, trust me, they'll bring that to the local table to have a talk about.
Absolutely agreed. And I think that probably on that line in the sand in those conversations, having this costing and having this study to look at will make that conversation much more clear for everyone. So I think we're agreed on that, on the two costs in the public sector. Up next, we have domestic workers. Yay or nay? Based on our prior conversation, I would say I think everyone seems to be on the yes side on this one. Seeing heads nodding. Okay, so I'm just going to circle yes to keep us moving ahead. Okay, up next, what are the requirements? Sarah, I don't know if you want to give us not to put you on the spot, but you've had a lot more experience with this. Do you have any?
Yeah, no, I'm just trying to remember in the Better Balance grid what this referred to in terms of certifications or.
Absolutely, and I do apologize. We do have the two frameworks that we're jumping back and forth.
Yeah.
Colin put this together to sort of give us sort of a larger overview, but yeah, this was, if everyone has two screens up, if you want to look at the Better Balance, there are those good examples of like, what are the requirements to vest into the system in other states as well.
Did someone share that Better Balance document in the chat? Do we have a link to that?
Oh, sure, I can. Do you want to see the Better Balance chart, or do you want to see what everybody responded, with earlier with your own recommendations? I can share both of those charts. But.
I guess if you could share both of them, that would be helpful, just because I can't
great.
find exactly where they are. Thank you.
Yep. Might take me a minute.
Yeah, this is what I was talking about in terms of, for example, in California, having to have earned enough money and paid in and been part of the fund before being approved for paid benefits. Yeah. So, I mean, my view or my recommendation would be that having a bar that is not zero would be a good thing, both for solvency of the program and also for a sense of ownership and a sense of community and contribution and all of those things. And I think it also helps to build support for the program generally and have it feel much more like a sort of communal insurance program and less like a free benefit, which it is not. So I would support some sort of requirement there.
This is where I definitely defer to others. I don't know what I would want the requirement to be, but when I started doing this work almost 9 years ago, one of the phrases I heard that sort of stuck with me was, thinking of it like your piggy bank, that we're all saving away. We're all putting our little bits into the piggy bank so that it's there when you need to take it. And I know that's a really simplistic view of it, but yeah, some sort of bar, because that helps, everyone be able to vest in. The one thing on the requirements I would like to see, if possible, and this is where I don't know how this gets into the actuarial study, the portability. So, if you're on the public option, we'll get to that part of the conversation later. If you've already vested, say you've been in an employer 10 years, you've been paying in, you go to a new employer that doesn't offer a plan, but you've been in the system, that you do have that portability because you have spent that time paying into it and you're not starting over again from, square one. For me, that's my only really big thing that I would like to make sure that's part of this conversation and looked into as well.
Yeah, in terms of moving from an employer that has a private plan to moving back into the public plan, I'm not sure that we need any actuarial review of that particular part of it. That's a lever that, might not have that much of an impact. I will say that in terms of simplicity and having really cleanly delineated concepts and being able to message effectively to the community, this sort of bleeds into the question of, is this particular recommendation going to include job protection or not? Or is it just a wage replacement program? Because that fundamentally changes what we're talking about here. So if it's job protection, then it gets much more difficult to build support for something that says, day one of employment at a new employer, go ahead, take leave. It's just a different animal. But if you're saying that what we're recommending is a wage replacement program only, then that portability, if it's just the financial part and you've already worked for another employer in the state of Maine, you've paid into the fund, then it becomes a much more intuitive thing to say, yes, go ahead, take your leave, you've paid into the fund, and we're good to go. Does that make sense?
Definitely. Thank you, Sarah.
Sure.
Wendy?
Well, looking at across the Better Balance worksheet, it looks like, I was looking for commonality here and it doesn't appear there's a lot of that. But it looks like most states are using a dollar threshold versus a number of weeks or period of time in a position before you're eligible. And I would say that is certainly going to be a very inequitable situation because some people might earn $2,500 during their first week of employment, whereas a frontline employee might take several weeks to earn that. So I would recommend that we land on a period of time, and then maybe we can capture or account for the portability situation as well, in addition to that. But in general, is it 4 weeks, for instance? Or I don't know. It doesn't look like there's any magic number here that's sort of market practice, but it just struck me that to use dollars as opposed to time and job could really be very inequitable. So, your new CEO comes in and, in a couple of days, they've earned enough to have time away. That's different than the people on the front line.
Yeah, particularly if that dollar amount is more than $300. Yeah.
Exactly. Yes. And I do agree that the job protection is an important discussion to have here as well. And I do think this should include job protection.
So I think looking at the Better Balance, when I was reviewing it last night, I had the same problem, Wendy, of being like, whoa, this is all over the place. But thank you. The dollar amount was a concern. And I'm wondering, maybe this is what I was also trying to pull out of the Better Balance. And maybe this is something we just ask the, folks who are looking into this, of like a commonality of time. So I don't know if this is another one where maybe we ask them like what the impact would be on 3 different, like 4 weeks you vest, 8 weeks you vest, 12 weeks you vest. My only concern, and I don't know the answer to this, is when we're looking at seasonality. So
Right.
employees, because we also want them, and hopefully, Sarah, I think you already said this, that it doesn't matter as long as you're paying into the system. So you could have had 3 weeks, busting dishes at X restaurant, followed by 6 weeks working as a main guide, and then you're invested in.
Yep. A super quick follow-up to that. The concern around how long it would take somebody to achieve a certain level of, dollar amount, based on the way other states are doing this, that wouldn't necessarily play out in an inequitable way, because it's quarterly earnings. So it's not necessarily that once you've earned your $300 or once you've earned your $5,400, that's the day that you become eligible. It's, have you earned X amount in a calendar quarter that's already over?
Okay, that's
So,
cool. So typically
yeah.
you would have to have been there for a quarter of the year, though? 2-3 months? Is that
Yeah,
typical?
so different states have different approaches to what to do in the event that somebody hasn't been working all that long. So for the most part, these the framework is you look at 4 calendar quarters, and over those 4 calendar quarters, you identify either your highest quarter or your highest 2 quarters, and look at that in terms of what did you earn in a calendar quarter that's already over.
That's helpful.
Yeah. So if somebody has only worked, for example, for 1 quarter, I would have to go in and look at the details. But there are provisions around what to do when somebody hasn't worked for like a year and a half.
Okay.
So there are ways to get at that issue. But the issue around, well, how many pay periods basically would you have to work to achieve a certain dollar amount would not. I mean,
Okay.
I wouldn't want to do that either, Wendy.
Right. No, well, the summary makes it look like that, right? So thank you for that.
Yeah. Yep.
The New York description says that they generally have to have been employed for at least 4 consecutive weeks by a single employer. Do other, across these states, we're not seeing that in this summary that we have, but do other states have something like that that's just not here in our summary?
That's odd. Or New York has chosen to do some things that are different. So for example, New York doesn't have a completed calendar quarter approach. What they do is they say, when you're starting your leave, look at the 8 weeks leading up to your first date of leave. What did you earn in those 8 weeks? And then average that out. And that's the dollar amount that they use for wage replacement. So they've gone off on their own.
So in the information that you can see that you are aware of that we don't have here, can a short-term employee take this paid leave and, sort of, do you have a median market practice or, a predominant market practice across the board? Do you know?
In terms of whether somebody can take leave when they're a very new employee.
Right.
If they're a very, very new employee in the state of Maine, then, or in the state that you're talking about.
No, in the market data, yes. So if you're looking
Right.
at the market in all these states, the 9 states that currently have paid leave.
Right. So for example, if somebody worked in the state of New Jersey and then they moved to California, they wouldn't be able to take California paid leave right away. But if they moved from employer A to employer B in the state of New Jersey, then they would be all set. Does that help?
To a degree.
Okay.
Not a lot. I think I was trying to get at the question of, so if somebody's a new employee and they have an issue that comes up, as they enter employment, either for the first time or moving from one employer to another. And I think we can address the portability issue separately. I was just trying to get at what's sort of a simple way for us to say this person is qualified for this benefit.
Right. Okay. So, and I think the phrase new employee is just really important to be precise about, Because if you're saying new employee because you just switched jobs, but you've been working in a state with paid leave for longer than that, then in most states you would be okay. Because the portability goes across employers within the same state.
Right.
Commissioner Fortman?
So this is just a question about whether the portability and also the date that the coverage begins are actuarial questions, or if they are policy questions that would be addressed outside of the actuarial study. And if perhaps that was the kind of data that meta study that you had mentioned earlier, Senator, if those perhaps could be the kinds of questions addressed there for data gathering, or just a question.
I'm wondering the same question too. I don't know if I... Yeah, I will say I'm curious from an actuarial perspective, what the implications would be of allowing folks to take paid leave before they've paid into the fund. Like, would the fund be solvent if we did that? It's a good point and a good question. I think that's definitely a question we should write down and have Colleen and Anna to make sure that we put that in with the recommendation. So I'm sure everyone else is thoroughly in the on this one. I don't know, Colleen and Anna or anyone. Do you think it's fine in the actuarial study to just say what requirements are needed for equity and solvency within the fund? Does that make sense? I'm trying to think of a simple way. If anyone has any good verbiage, please jump in.
Yeah, I mean, I think that makes sense because I think if you remember when you look back at a lot of the other states, people start paying in for a set amount of time before they can start drawing down the benefits. So I think that seems to be an important question. You know, there needs to be a threshold amount that's in the system before people can start drawing down their benefits. And so maybe that might go a little bit to Sarah's question. Sarah's really, I think, was talking about individual employees not having paid in and being able to draw down benefits versus having an available pool of funds to start supporting everyone at a certain point of time. So I think that is kind of an actuarial question that might make sense to kind of try to get, you should have a sense of. I don't know if there's any other, folks have any other comments, but it seems to me you would need to know, how much needs to be in to cover, say, every, whatever component of folks, and how long you would need to collect, how long it would take you to collect that money. That also would be an important actuarial question, I think. How long that lead time period needs to be for a state like Maine to get all those contributions collected and be ready to pay benefits. Does that make sense?
Yeah, that's coherent. If it's phrased like that, I was able to follow that one. So I think that checks in. Emily?
I guess another question that I have related to this is it possible to offer leave sort of right away and require participation on the back end of that leave in order to access leave again? So like you can take leave, you can move to Maine, you can work here for a week and you can take leave, but in order to like the requirement would be that you participate in the program for a certain length of time after that leave in order to be able to access the benefits again. Just as a way, because I do really, really think it's important to think about people returning to the workforce and just giving them people out of recovery, parents who haven't worked in years, who are just kind of rejoining the workforce. And we don't want to create a situation that deters that, I think.
Definitely. Sarah?
So I would, in terms of how to frame this piece of the conversation with the actuarial folks that we end up working with, I wonder if it would make sense to maybe pick 2 states California looks to be on the low end of this particular topic, and Connecticut is sort of on the high end of what's required. Would it make sense to say what would the California approach cost, and then what would the Connecticut approach cost?
I don't know why, but this is one of the questions that just my head popped off trying like this. Yeah. Yes, I love that idea. And I'm seeing thumbs up, similar nodding. Okay. So unless anyone has any other questions, thank you, Colleen. Thank you, Sarah, for giving us the verbiage that I think is coherent and clear as mud on this one. Up next, what family members? Oh, Representative Stearns.
Thanks, Maddie. One of the pieces that was mentioned was the job security component. And my question is, the work that this commission is doing, is the intent to replace Maine's Family Medical Leave Act, or will that act still stand and this will be complementary to it? And I'll go forward and say that if this is going to be complementary to that, I don't think that anything in what we're doing should vary from the Maine Family Medical Leave Act.
You're reading my notes.
Okay. It's already confusing with the Maine versus the feds.
Yeah.
And the last thing we need is to add another layer of confusion, in my opinion.
So we have the job protections, and I'm sorry, I'm being a stick in the mud and trying to go through in the order that Colleen gave us, but I'm trying to hopefully make it easier for Colleen while she's taking notes on our conversation. It's the third to last question on the list. Sorry, Representative Stearns. But I'll just say it real quick, and then we'll jump into the family member section. One thing that I think is important for us to remember is that we do have the federal and the Maine portion, and that, you know, we have areas within what's in statute that I think we can improve upon, but we should definitely make sure that the actuarial study and all of us understand that this is made possible by following something else that's already in statute with complementary, like expanding the portions that we've discussed are not comprehensive enough. I think I'm seeing some nodding, so I think that was mostly coherent. Because we know there are some definitions that we even have bills in front of us this session that are looking at that and like areas that have been tweaked according to, you know, needs as well. Family members, which honestly I think actually just goes right into what we're talking about, and your point, Representative Stearns, is the definitions we currently have in law. And Drew Christopher, I know that you had some language on this as well. I think this is that place where the rubber hits the road of trying to make sure that, you know, we are, you know, Maine has our current FMLA statute. Is there anything that's not in that we want to make sure that's expanded upon, or we get the cost of what it would be to expand upon those different areas that are left out? Anyone want to take a stab at this?
I think you could, sorry, I didn't raise my hand. I think you could ask the actuarial folks to tell us what it would cost to cover family members that are specifically listed in federal FMLA. Separately, the cost of those that are specifically listed in their Maine FMLA, and then the cost of the family members expansively that we've been talking about, family-like relationships, blood and affinity, that sort of approach as well.
I'm blanking. Was it Connecticut that had the in kind? So I'm wondering maybe we
and New Jersey also. Yep.
In New Jersey, if we could have the actuarial, because that was closer to the more broad definition that we were looking at. I like that idea of the 3 federal, state, and then here's what we'd like to see and what's the cost.
Yeah.
Barbara?
Is it easy to say what's the difference between what the feds have and what Maine has?
I know Maine is better than the feds, but I think that on most things anyway, so I might be biased. But anyways, kidding aside, I don't know, Sarah, or if anyone.
Yeah, I don't have it handy in front of me right now, but I believe there's a couple of additional family siblings, I think, and grandparents that are not part of federal FMLA.
Okay, thanks.
Yep.
So Drew, Christopher, and then we've had our Emily to take a quick break, which I think actually wise because I have drank through all of my water and coffee and could definitely use a little more water. So Drew, Christopher, let's do your question and then we'll take a 5-minute break.
Yeah, I'm not sure. When we were working on paid sick days, we worked a lot on the definition of family, and our national partners pointed us to the fact that the federal government, in some places at least, uses an individual related by blood or affinity to the employee whose close association with the employee is an equivalent of a family member. So it's something that the federal government already uses, and I think really addresses all the things that we've been talking about. So that would be my recommendation on how to do sort of a inclusive definition, and having them look at that would be my thought about it.
Sounds good to me. Any follow-ups, anything you need from us, Colleen and Anna, on that before we take a break? All right.
Good.
Everyone, 5 minutes and stretch and come back as refreshed as you can in 5 minutes. We'll jump right back in. And also a reminder, make sure you turn off your video and also put yourself on mute.
So it took me a while I was sitting in that meeting, but
Barbara, I think your Zoom is still unmuted.
exact information, they put 2 little deposits in my bank and I was excited on what they were. I told them, I had the same problem, they verified me recently. So then I went to the debit card associated with that same bank account and they went fine, they were fine with that.
Okay, I think we're all slowly petering back in. So we get Colleen and Anna back. What's the temperature for everyone? Is it starting to, I just looked at it, it looks like we're at about 18 here in Brunswick. I'm sure Representative Stearns, it's a little bit colder for you.
It was 78 degrees when I just stepped outside.
It's going to be an interesting 48 hours. Well, I think we've got mostly everyone back. Just real quick, Colleen and Anna, the next question I have up is the funding portion. Was there anything you needed from us on the other questions before we jump in there?
I think we've got enough of an outline. Sure.
Perfect. Okay. Jumping right back in. And first I will say, thank you everyone. This is a really robust conversation, but it's a good reminder of how complex this conversation, this program is, and why I'm grateful for everyone being willing to really jump in and be really deliberative on it. So on further easier things to determine, how is the program funded is the next question we have. Now, I think we've all said this in one way or another. This is not our areas of expertise. I think a few of us have worked on things like this, but I haven't set up a large statewide fund. So wondering if anyone has any suggestions of how to pose this to the actuarial study about what numbers we need to be able to make something solvent, but also part of the conversation we need to have. We did ask how much people would be willing to contribute. We do need to sort of talk about employee versus employer. I also see this as being where we sort of talk about potentially that small business exemption or supports, and some of the questions we'd like to see in that area. So it's not just a simple of, I wave my magic wand and this is how it's funded. I think it's a little, like all of these questions, a lot more complex than just that. Sarah?
Yeah, I was going to say something very similar to what you were alluding to, in that I think it would be valuable to get actuarial insight on some of those levers and mechanisms around what would it cost if we set up a different framework for very small employers, if we set up some sort of support for the cost of temporary workers for small employers, those sorts of things. But in terms of how are the contributions split between employee and employer, I don't know that we need actuarial information on that. If we know how much it costs, then it feels like a policy decision to say where to strike that balance.
Makes sense to me. Any other thoughts? Barbara?
I mean, I don't have any expertise really to add to what Sarah just said. I have an underlying principle that while I think the employers should contribute, and I was interested that 60% of the employers in the survey agreed with that. That's a higher number than I thought we were going to get. And I think there should be an exemption for small businesses, and we should figure out where that is. Just from a principal point of view, there is a benefit to the employer to have this program. It will help them in terms of recruiting. I think on balance, the greater benefit probably goes to the individual. So I'm in general, I'm going to say, I think there ought to be a contribution from both. I think the overall number probably might be greater for what the employee is giving than what the employer, but I need the actuaries to help me with that. And yeah, Sarah's going back and forth about that. But and I certainly, as I've talked to businesses, there is concern around what the contribution will be. So that would be my point.
Thank you, Barbara. Representative Stearns?
Thank you, Maddie. I think that my thoughts are very similar to Dr. Crowley's, but I would spin it perhaps a little bit different. I was surprised by the data as well. that came back from that small sample on the survey. I think we should make it employee funded to meet the needs. And I think that competitively, in order to compete, you will find if employers have the option to pay a percentage of that for their employees, or they will do that to compete. That's just my thought on it. But we need to make sure that we cover the basic need universally, if you will. Maybe that's a bad word, but.
So I'm wondering if we could kick it to the actuarial study to cost out the differences on this. Wondering if it's something we can ask them once they have a number, being able to cost out what it would be for employees and employers to contribute equally, with also self-employed individuals only contributing the employee section. And then maybe potentially also looking at the cost of having a small business exemption. I know we heard there's already existing in state law, I'm blanking on the number, so if anyone knows it and could help me out, within the paid family leave, that paid time off that we passed, I think, is it Commissioner Fortman, actually, if I can pass it over to you, if you can remind me of what that number is.
It's 10 employees.
10 employees. Okay, so maybe the 10 employees or fewer. I don't know if anyone has a stronger feeling. One of the other numbers we heard was 25. I don't know if we just leave it up to the actuarial study, but also state, we already have existing Maine law. I'd like it to, mirror that. Just tossing out a couple more ideas for conversation on that. Drew Christopher?
Yeah, I mean, I think from a policy perspective, I would definitely be advocating for contributions from both sides. I mean, I think, again, there's a benefit to everyone in this situation for having this policy in place, and there are responsibilities that come with being an employer, and sometimes those responsibilities include costs. So I think it's important that it come from both sides. I guess I'm curious about the question. What I feel like I heard Sarah was saying was basically like the program's going to cost the same amount no matter what. So do we make that, like, is there something that the actuary study needs to actually look at around this related to who's carrying which parts of the cost, or do we just need to understand how much it costs and then have a policy conversation? So I just wanted to, I think that makes sense to me, but I wanted to be clear about sort of like, if we are having a conversation about this, I want to be clear about where I'm coming from. And I do think, as I said earlier, like, I think looking at ways that employees are covered regardless of what business size they work for, and if there's ways that we can support businesses around that as a way of making sure that it's universal, in favor of looking at the cost of that kind of program.
Definitely. And the more, Sarah, the more I think about your suggestion, I really like that, because you're going to have an estimate of looking at all the other sort of aspects we have to be able to cost out. You can say the program costs this much, which then either the actuarial, or perhaps maybe if we get the second sort of meta study, could be like, well, that equals out to 20 cents per paycheck per employee, 10 cents per employer, or just sort of get into that policy at a later date once you have that number, which I really like that idea, because then it gives us that concrete number to work off of for the policy perspective. Emily?
Yeah, I think that makes sense. I think the only thing the study might be helpful with is the number in terms of employees, like the threshold for businesses. So assuming there's an employer and employee contribution on some level, if we exempt employers with 50 or less, or 25 or less, or 10 or less, or those sorts of numbers, maybe where the study is necessary. Or I don't know if that's maybe sort of that second step study that you were talking about.
Maybe in the recommendation we can ask, because I feel like, this is their profession. They'll be able to tell us if it's something that factors in or not. If they could give us that number of what exempting 50 employees or fewer would be, what exempting 25. And so then we could sort of see what that hole is that we're going to be stuck filling, and finding ways to be able to make the fund solvent. Or I think, Sarah, you'd mentioned other ways that then you're helping. I think it's the Washington law has other supports for small businesses with sort of like the temp help as well.
And I can get more information for you on that.
I'm seeing nodding going around the Hollywood squares on that one. So I think we've sort of arrived at a Dear Actuarial study, give us a number so we can work back from that for policy. And then potentially give us some numbers on the small business exemptions and what do people, and I would say in the request of the actuarial study, if they want to, if they have numbers that are linked to other portions in other states or Maine law, but maybe we'll say 50, 25, and 10, sort of to look at the 3 thresholds, just to throw out there. Okay, so moving on, what percentage of wages? This is one of my notes I'd put down, would really like to get a range from the study, and looking at the better balance and looking at the states across there, it really does go all over the place. So I was wondering if anyone had any really strong, I really think this is something where we need a couple of examples. You know, we can't just get one recommendation. And I think it does sort of almost get back to the prior question of maybe we need to come up with that cost and then go from there of like what people could draw reasonably without creating insolvencies within the fund. Emily and then Sarah.
I feel pretty strongly that we should look at 100% wage replacement for the lowest wage earners, and you know, just it can't hurt as part of the study to know what that would cost to accomplish, because I think that's important for low wage earners to get 100% of their wages replaced.
Mm-hmm. Definitely, Sarah.
So I think that 90% or 95% might be a good goal. And I say that because I absolutely share the concern around folks being able to access this leave if we put forth a recommendation. I also really, really, really want to see something get passed. And I wonder about the political feasibility of passing something that says 100%. Just including that for sake of conversation. In terms of the what needs to go to the actuaries around this, I think we need to, I agree that it makes sense to look at a couple of different rates. I also think that in this conversation, we also need to be looking at what the max benefit amount is going to be, because that, I mean, that's the difference between somebody who earns $200,000 a year getting, you know, obviously somebody who earns $200,000 a year is not going to actually get 70, 80, or 90% of what they earn in a regular week, because there will be a cap, but we need to talk about what that cap should be so that the actuaries can give us good data.
Yes.
That's it.
Say my brain just literally hit like a what I do want to say on the political ramifications, I think once again, want to say it again, let's not worry about that. And I think that is exactly why we need to look at what 100% costing could be, what a 95% costing could be, what a 90%. I mean, we probably don't want the actuarial study to go all the way down like 100 through 50, but within a reasonable framework. And maybe that's something we sort of defer to them, especially if they're ones who've done those studies before. And then, yes, I think that does get into the conversation of what the maximum benefit is, or potentially, you know, what the guardrails are. Is there a minimum? Is there a maximum? So, Drew, Christopher?
Yeah, I also support like at least looking at 100%. I think it makes sense to start there because that's probably what really folks need. But I know we need to look at some other things in terms of cost. And I'm wondering if it makes sense, like we sort of said earlier, to kind of pick a couple of the states that already have these and sort of be like, what would it be for each of these, for the sake of us understanding and them understanding what we need to look for.
Definitely. Barbara?
You know, I'm also thinking about simplicity. I'm thinking about simplicity, and some of what we're talking about when we want to do ranges in a number of different scenarios. I think it's going to be up to us a little bit, even starting now, to do some of this simplicity work. So in my head, I'm thinking we ask the actuarials maybe 80, 90, and 100%. I think we should understand what the cost of 100% is. I think there should be a cap, because this is really, you know, honestly, it's about a safety net for lower and middle wage workers when they have an event that requires them to stop working. It's really not about so much about upper. So I think with that in mind, we have to give some pretty simple. Otherwise, I'm a little worried about how much time and cost it's going to be for an actuarial study if we don't get this a little more simple. So I think 80, 90, and 100%. I think coming up with some, and I honestly need somebody else to help me with which of these caps makes the most sense, or maybe there's two different caps we ask them to look at. But we got to be careful about how many things Colleen and Anna are going to be trying to write into this. Okay.
It gets back to the hospitality world on a menu. If you have 150 items on a menu, you're going to be in trouble.
Right.
I do like the idea of 80, 90, and 100. Does anyone feel strongly one way or the other on that? Okay, I think we're going to stick with 80, 90, and 100% before we move on to talking about the caps. Emily?
I just kind of have a question. Wouldn't the percentage of wage replacement be also tied or correlated to the number of weeks that we're talking about? So like, I feel like, you know, it seems like logically, if you're offering shorter time, you could offer higher wages, or, I mean, maybe that's not true, but that's kind of how I've been thinking of it. So I wonder if those two things are, you know, so interrelated. I don't know that they can be separated from one another.
So other states that have paid leave programs don't necessarily do what you're describing. If I understood what you were describing correctly, it's one amount of available time, and the wage replacement rate would be consistent across the entire absence. So if it's 12 weeks, 20 weeks, what have you, the wage replacement rate and the maximum weekly benefit amount are the same for the entire absence, regardless of whether you're taking 2 weeks off or 20 weeks off.
Right. I guess what I was saying is if as a program, we're saying you can take up to 26 weeks off.
Got it. Yep.
Then does that say, well, then you really need to go down to 90% or
right.
or whatever.
Yep. In terms of being able to afford the program.
Yeah,
no, that makes sense. Yeah. Thanks for saying it a different way. It made more sense in my head the second time. Thanks.
Okay, no problem.
Yeah, that's where I'd have to kick it back to the folks looking into that. But yeah, no, that's actually that's a good point. Any other thoughts on that? I think we stuck on 80, 90, 100, but I think Emily, getting to your point, sort of gets into discussion of the week, and maybe just a general question of, for solvency, if you're looking at X amount of replacement, like you're saying, you have to phase down. But I feel like that's something that's flagged for us. Maybe I'm being too optimistic, but.
Do we also need to talk about a cap though, like a dollar amount cap?
Literally the next question. So perfect segue. The maximum weekly benefit, or cap, is what we'd want to discuss. So Emily, I don't know if you want to jump in on it. That's what
I don't know that I have enough of an opinion about it, but it looks like just the other states have based it on their average weekly wages, which Maine is right around $1,000 right now. Is that correct? Okay.
That's what I have in my notes, is based on average Maine weekly wages, as well as with an adjustment. We heard from other states that it needs to make sure it has a COLA as well, to make sure it's, moving with the times. Any other thoughts on this? Everyone sort of seemed to sort of based off around what the other states looked at with the average weekly wages. Sarah?
Yeah, the only reason why I think we might want to have a little bit of conversation around that, and I'm not sure if it's an actuarial conversation or a policy conversation. I was surprised in the demographic data presentation how many people in Maine have part-time employment only. So that brings down your average weekly wage. So for a full-time worker who's out on leave, I'm not sure that having a cap that's tied to the average weekly wage without maybe going a little bit above the average weekly wage is going to really be workable for folks. Just something to think about in terms of what that means and how that number is arrived at.
This is one of the things that's been the hardest to sort of puzzle out is how do you make it equitable for someone who, you might have somebody who's working part-time, but they're working 3 jobs part-time. So
Right.
putting out to 80 hours a week. And that's where I think paying in, investing, and having it based off of that makes sense.
Okay. Yeah.
That's me just throwing things at the wall and seeing if they stick on that one. I don't know, Commissioner, this is your world. You spend a lot of time with this data. I don't know if you have anything you can say to guide us or any advice.
Other than those are good questions, that circumstances are very, very different. I think that if we get back to simplicity is average weekly wage, which is calculated all the time. Whether you want to keep it at average weekly wage or do some percentage over average weekly wage, it would have to get calculated separately. But there are many things that are based on average weekly wage. And it's an easy number to get, and it does change every year.
Yeah.
So it automatically has that built-in index as long as you're updating it yearly.
Maybe we state it around there. And then please tell me if I'm going way far off trying to make this simple. One of the other questions we can ask the study is how, you can't ask them how do you make it equitable, but is there an reflection of hours worked? This is what I'm like, this is what I can't quite.
There's no place that currently collects hours worked, which is the problem, Senator. That, the wage data that's collected is strictly wage data. We don't know if it comes from, as you said, 3 jobs or 1 job. It's the wages that are earned. So that actually, now that I'm talking out loud here, that information, the individual would have that information for all wages that were earned. The question is, would they be taking that leave from their 3 jobs, or are they taking it from their 1 job? And I think we'd have to think through that. The place that the equity comes in a little bit is if you're looking at, so you're replacing 100% of the wages for someone below a certain threshold and 80% for people above a certain threshold. You could play with the numbers on those ends.
We had talked about, all of us sort of in the beginning, of having something that sort of reflected those different brackets. I don't know if, I'm thinking through this, just if there's a way to ask the study to sort of figure it out within. Commissioner, is there something that within that weekly wage information that has, we have our tax brackets, but is there something else that it could be linked to for a sort of like sliding scale? Yeah, that's it.
I'm happy to try to mull it over, but there is nothing that kind of leaps to mind that readily provides that information.
We'll leave that in the notes, see if Commissioner has a magical new data point that doesn't exist. No, just kidding.
I don't think it's an unasked question, right? So I think insurance companies are quite accustomed to dealing with employees who are taking a leave, and it may be from multiple employers. So I think there are answers we could get from people who have a lot of experience with that.
So I guess maybe we ask the actuarial study when we're on the subcommittee. We literally just put this as one of because we have an anything else portion. So I think maybe this is one of the questions that we put in the anything. Yeah. And we're like, we're not exactly sure how to, here's the equity. Maybe this is the way we phrase it. This is the equity issue we're trying to get at. What is the best mechanism and what would be the financial ramifications that work within the solvency and the universality of the fund? Okay, I'm seeing nodding. Hoping.
Yes, I like that, what you just said.
All right, perfect. Thank goodness it's being recorded, so I don't have to repeat it twice. Up next, unpaid waiting period.
Hey folks, I'm gonna actually have to jump to another meeting, so I'm gonna jump out now, but appreciate all of you and the thoughtfulness of this conversation.
Thank you so much, Drew Christopher, and thank you for all of your work.
Did you skip over how long the benefits, or I thought that was my next question.
I totally did. So it was.
He did it on purpose, but yeah, that was the next.
Let's definitely move on to how long, because I think that's the one we keep circling around. So how long? Or is this another one of those questions? I think this is one of those questions where we need to get a couple of different data points from the study. So maybe picking based off of looking at the better balance of sort of the average, it sort of seemed like 12 weeks was sort of like a good base starting point is what we were seeing from most of the folks, right?
I was going to say, I don't want to start any less than 12 weeks.
So maybe some of the states, this is where you're getting into like the policy nuance. So I think maybe for the actuarial study, we should just ask maybe like 3 different breaks of like 12. Sarah, I think I might defer to you to come up with 3, or the commissioner of like 3 fit within other states amounts. But the other thing we need to think about is, do we allow, some of the states do allow sort of a bump up period of certification of like if you have X, Y, and Z. I personally thought that was pretty convoluted, and for the point of simplicity, I think it'd be probably better to do 3 different time ranges and just have it fit all in there. But I did want to make sure we brought that up and see what everyone thinks of that portion. Sarah, I don't know if you.
So yeah, I agree. I think for simplicity's sake, it makes sense to have 1 bucket at a time. And I think 12, 20, and 26 might be 3 good numbers to use.
Emily?
I like those numbers. I think that's a good place to start. I'd like to see it, as high as possible, but also I guess it's more of a question. So like, how is the number of time when you're actually applying for benefits, how is the amount of time you're allowed to take calculated? Like, I assume, maybe a doctor has to say, yes, this person needs 10 weeks, this person needs 15 weeks, whatever that may be. So I'm guessing it's variable, and looking at the survey results that we got, it looked like there was a pretty wide range of anticipated needs. So is that how it would work? You think like people would be eligible for up to, let's say, 26 weeks, but the particular issue that they have only warrants 6 weeks, or whatever the case may be?
So I think they're pretty standard medically expected times per any kind of surgery, for instance. So, and Sarah, you probably have all this data, right? I mean, insurance companies certainly do. So if you take the short-term disability leave and you had an appendectomy, they're going to tell you that's a 5-day recovery or a 10-day recovery. And so that you would have to provide your medical documentation in order to support that. So even though the maximum is 12 or 20 or 26 weeks, you personally are eligible for 2.
Yep, exactly. Yep. You have to provide certification from a medical professional, and then that drives how much you're approved for. Where it does get, so where the conversation would depart is around bonding with a new child. So there, I mean, like the data might actually provide for a certification of a year, in terms of, how much time do you really need and the benefits and all that. But so most states split it up and say a certain amount of weeks are available for bonding with a new child, and and then another bucket of time is available for medical leave. And we could certainly recommend that, or we could recommend 1 big bucket of time for simplicity's sake. I think it does that it's so interwoven with the conversation around how many weeks, because if it's a 12-week bucket, then it is probably a much easier sell to say, use that for whatever you want. But if you say 26 weeks, then there are people who will say, you don't need 26 weeks because you had a baby. So the conversation just changes.
I think this is another one of those points where we benefit from other states having done it, and also more more crucially, I think businesses and insurance agencies who've been offering this sort of, either it's short-term disability or paid family medical leave for employers, that there already are sort of the built-in guardrails for doing that certification process.
Mm-hmm.
So maybe of asking those 3 time lengths, we talked with like 12, 20, and 26.
Mm-hmm.
And then I think that gets into the policy perspective of once we have that, the recommendations, either we can, kick it back to the labor committee and be like, here's what these costs are, have fun with the policy, but we can also probably put in some, like the headers and footers, like Representative Stearns was talking about, of like, please keep in mind, these are the ramifications of like what needs to be considered within this period of leave. If that makes sense for everyone.
Yeah, the only other thing I'd add is that perhaps in the meta survey data that we're hoping to get to, there's the difference between how much leave is available and how much people actually use.
Yeah.
And that might be nice for somebody else to look at some of the other states that have this, and in fact, how many weeks are actually used.
Mm-hmm. We could put a note of that sort of in the general anything else. I think that's a really crucial question. And I also have to say, I'm so infuriated as a company formerly known as Facebook for taking the name Meta. So I just want to make sure everyone knows we're not asking this to be a Zuckerberg Meta study. So joking aside, any other thoughts, or do we seem pretty settled on the 12, 20, and 26? And then everything else we've discussed is sort of falling in with that greater sort of the work after we have that costing. Okay, seeing the nodding. Now, Colleen, am I correct? The next one is the unpaid, the waiting period. Okay, now that we're back in the right order. Thoughts, feelings? I think we've sort of discussed this a little bit already of people thinking, what are the requirements? I think this kind of feeds into that question as well. Anyone? Emily?
I guess I'll just say no. I don't think there should be a waiting period. If you're certified by a doctor that you need this leave, I don't really see the point in having a time period to be, unless there's a reason that I'm not thinking of, but I can't think of a reason to have a waiting period.
And just to clarify for folks, this is someone who's already vested into the system, met the certification. It's like, this is not someone started on day one and is doing that. This is a separate aspect. I'm seeing the Zoom nods. Anyone feel strongly otherwise? Okay, we'll say no unpaid as long as you're meeting the requirements. You're good. Job protections. We touched upon this a little bit. This is one that the more we've had the conversation about it, if we've sort of been moving towards this, I don't think this is necessarily a question for the actuarial study. Does anyone feel strongly otherwise? I think this is a larger policy conversation, and I agree. I don't know. I think it might have been you, Representative Stearns, and apologies if I'm miscrediting it, about trying to make sure you're not stepping over existing state statute and work that we've done a lot of work on this as well. Like I've done a lot of work about domestic violence job protections when you are seeking care. So I want to make sure that, I think maybe this is just a question we just leave as is, and it's not something the actuarial study has to cost out within those parameters. Okay, seeing nodding. How is insurance provided? I will take a first stab on this since I've been sort of kicking the can on the other questions. I think if we can ask the actuarial study, I would like to look at several different options. I think startup costs is going to be the same no matter what, but we're going to have sorry, I said that wrong. We're going to have a startup cost that's sizable no matter what option we go with. But I think, I don't know, and Commissioner, feel free to jump in at any point on this one. I think an actuarial study, I know there was a prior bill in a prior legislature where they came up with a figure that it'd be on governmental cost, but I'm wondering if there's ways to look at sort of the options of having an entirely public option, having a public-private option where an employer, as long as it meets the requirements of the state program, they can have their option. And then I don't know if it makes sense. I don't even know if this is something we can look at, the cost for like the third option where you have the public and the private, And then like Connecticut was, I think they're working with what, AFLAC to issue their program. I don't know if that's something an actuarial can study, can look at, but that seems to be, when I'm looking at the better balance, those are sort of the three options that we've heard about. Correct me if I'm wrong on that. Anyone?
That
Yeah, I
sounds
think-
right. Sorry.
I'm
That
sorry.
sounds right to me. And I also, I think that we've heard from Wendy that the private sector can be helpful in some ways. So I think it's definitely worth us having them look at that.
Definitely. And we also have other models from other states to be able to have them look at as well. Sarah?
Yeah, I was just going to say that I think where the value might be from the actuaries in terms of this question is really around what the impact might be if there is a provision in the recommendation to allow employers to opt out and set up their own private plans. But, in terms of solvency of the fund, what levers we need to think about if that's part of the recommendation.
It's a really good reminder that I had forgotten about that we had heard from, I think it was Washington, where the opt-out, how do you pay for the solvency of the fee for allowing that? And maybe that would be the anything else section that we'd kick to the actuarial study.
Yeah, I think it's the fee and for what it would cost to review the applications. And then also, because you're taking all of those wage earners out of the pool. And so all the contributions that just to, I'm not necessarily saying that should or should not be an option, but what would the financial impact be?
Agreed. Or I'd say ditto or seconded, as we'd say in a committee. Emily?
So I just have a question. So basically what you're saying, I think, is that we ask the study to determine the cost of a state option versus something administered privately.
It'd be three separate. So you'd have, say you have everyone's covered in the entire state. It's run by a government entity. And then you're calculating the solvency of that fund based off of how many workers you have in Maine, and they're all paying it in. Next one is what sort of Sarah was saying is if you have the public-private, so employers can opt to have their own private program for their employees as long as they meet the baseline. When that pool of employees is removed, so the study sort of makes a guess on what that financial impact is of not having those employees applying into the fund. So it's getting sort of a cost of what that public-private option is. And then I don't know if the third option is something the study can cost out, but the other model we saw in other states, and would be great if we could get a model. Now, obviously it depends on the providers, but where you have public, private, and the public is contracting with other entities to administer the program. So what we heard from Connecticut, and this is, I honestly don't know if the study can answer it for it, but we had heard that they had a cost savings by contracting. Like that's why their startup cost or their startup time, their launch pad was much shorter.
Yeah, I don't know if 1 and 3 are actuarially any different.
Yeah, that's kind of,
yeah.
But it's an important model for us to consider, I think. Having a private insurance company who has this expertise rather than creating a brand new entity within the state just seems to make all sorts of common sense.
maybe this is once again the anything else section where if the actual study, I agree, Sarah, I don't know if that's something that can be costed out, but maybe getting back to Representative Stern's headers and footers, maybe it's something we state that, this is another consideration of how this is administered through this mechanism.
But this conversation and a couple of others have me thinking that we really have to have the actuarial group telling us what kind of numbers do you need before you really begin to get such variability that is not really a sustainable program. And if you don't have public members, which is a huge group of employees in the state of Maine, in this pool, and you allow people to opt out with a private option, we may be spending a lot of time skating very close to an unsustainable number in the pool. So I don't know exactly how we're going to, I'm sure the actuaries are going to be presenting that to us, but how we put that in a single question or how it affects multiple ones of these.
And I think we also heard from other states that some had a very solvent fund very quickly, and others had issues with not having adjustments, or which employees they captured by mistake that weren't supposed to be part of it. So I think it is something that hopefully we need that number from the actuarial study. If you need X amount to make this solvent this amount of time, and then cost it out from there. Emily and then Representative Stearns.
Sorry, I forgot to lower my hand, but I will say that I think it's important that it's a publicly administered plan. Just from my perspective, I think that would be a more equitable way to administer it. But
Yeah, and just the reminder, I mean, this is, as Commissioner was saying, that we need to make sure we have all the numbers. So we're sitting down to like, it's like balancing your checkbook, making sure it all works out. Representative Stearns?
I was just thinking of the private sector, rather than an opt-out for individual employers. What if everyone were required to participate in the baseline, and then employers would opt in? In other words, an employer might say, we're going to opt into the tune of, you don't pay anything, we'll cover it.
Yeah.
And we'll go beyond it. But that way, the floor would be there for every single worker. It's just a thought on the private side.
Because Connecticut did that in a way, if I remember, it was costed across everyone, and then people could go above and beyond, if I'm remembering correctly. I think. If anyone from Connecticut is listening and we're saying otherwise, feel free to send us a message. But yeah, no, I agree, Representative Stearns. So I think we have some questions and some concrete like ideas for the study to look at, to be able to start costing that out and figuring out what that magic number is that we need to reach. Okay, I think, Colleen, please correct me if I missed any other questions when I was scribbling them down in my notebook, but I think we're on to the anything else portion. Is there anything in this conversation that we've not touched upon that we really would benefit from having a concrete number? Emily?
well, one thing, I'm really not sure how to get at this, but one thing that I keep thinking about is health insurance. So if, let's say you're an employee and you access this benefit and your employer is required to continue your health insurance coverage because of that, that's one scenario. If you're self-employed, however, you're likely purchasing your insurance through the exchange, and those premiums, don't change or go away because of an event. So I guess I'm just trying to figure out, like, how do we make it equitable for people who are self-employed and paying what are oftentimes pretty expensive insurance premiums? I mean, I can just give myself as an example. For our family of 4, we pay $1,300 a month for a very high deductible plan. So in addition to the expenses of the insurance, the health insurance premiums, my family would also be paying into my deductible because we have a high deductible. So I'm not sure how, because that's a completely different thing, obviously, but it's something I think we need to think about, because it could put people in a very precarious financial position and also make it somewhat inaccessible. So it's just a
Total thought, and totally something I thought about, but I think unfortunately that's something that falls out of the parameter of a paid family medical leave program, except for what the impact of taking paid family medical leave is, like you're saying, on your insurance qualifications. I don't know if anyone can jump. I know nothing about the ramifications other than, Emily, like you, from the self-employed world before I was a legislator, of what like paying in looked like. I don't know if someone wants to jump in, but I unfortunately see those as separate. I see them as very real in someone's life decisions, but as far as the policy that's in front of us.
I guess my question in terms of like thinking about dollar amounts and costs is, like, could there be some sort of subsidy for those people in those situations that's part of the paid family medical leave program, but separate from the regular benefit? You know, and I kind of have a similar question when we're talking about the cap, the dollar amount cap, and thinking about single income households versus multiple income households. Like, how do we, you know, just in terms of equity and access, how do we make the program accessible to everyone, factoring in these other pieces that are, you know, quite real? And I think, you know, a big portion of our people are self-employed or small business people in Maine. So I think it's, you know, something we should definitely consider.
No, does anyone have any other, trying to think of the right words, but unfortunately I do think those are two separate, especially when you think about how your insurance is authorized, like when you're buying it either through the marketplace. I think if it's under one employer, it could be different, but I don't think it falls under the bailiwick, sort of like the wheelhouse of what we're looking at here. Because it's, I don't know, Commissioner, this might be, I don't know if you can jump in, but just sort of, I think it's two different silos of qualifications and two different administered programs. And it's a very real consideration, but I don't think it's something that's within the charges of how, unless anyone, are there any other states that have this consideration within? Yeah.
It's a very real issue. We deal with it certainly when our employees are out on a leave. And what we happen to do is we try to make all sorts of arrangements for people if they want to use paid time off to pay for their benefit premiums while they're out, or we will suspend them. And then when they return over time, we'll make arrangements to have them pay for their arrears. But I recognize that not all employers have those means. But I would imagine a lot of the larger employers certainly try to work with employees so that we certainly don't turn off benefits, you know, but they do come back owing some money in some cases.
Anyone else on that? I don't think there's anything wrong with just stating, I mean, sometimes in our policy conversations, it's good to touch upon, you know, we might not have a solution, but just to remind people of the very real ramifications that can happen when you're going through this, that the cost of having a medical leave or the cost of welcoming a new child or, you know, X, Y, and Z is often greater than the number that might be on a sheet. And even if we might not have a solution, I don't think it can ever hurt to remind people that it's a very big process. So, but yeah, unfortunately, I don't think that's something that, because there's no other, I can't think of another model that has that within it, and it's not under our charges either, but I think it can't hurt to have sort of a note stating in the anything else section of there, it's part of an even bigger cost. So, any other thoughts? Great. I might totally just get the unstable internet connections if I disappear. That's what's going on, but Emily?
Sorry, I have another separate sort of anything else bucket to bring up. So I think one question I have, and this might be a policy thing versus a study thing, is how do we protect undocumented workers who are also taxpayers, especially, and also I think it's important to automatically cover workers who may not be on payrolls. And I just wonder if there's some sort of tax mechanism for this where, I don't know, you're sort of automatically paying a premium as part of your state income taxes or something that, and you have to opt out of it versus opt into it. So that folks are automatically covered. Just because in my experience in my industry, which is construction, I think getting folks educated and aware of a program like this would be challenging or could be challenging, but they would really benefit from it. So like if it was an automatic process, and that may not be a question for the study, but it's something I just want to raise because I wonder if there's another mechanism for for just creating that automatic enrollment.
Wendy, did you have a comment on this one? Oh, you're on mute.
Of course, how many times a day do we say that? I don't know about the specific one, but Emily's earlier question prompted me to wonder about, and Sarah, you might know this, do other states' programs require the continuation of health benefits?
Oh, you're on mute.
Yeah, I just wanted to help Wendy feel better.
Thank you. I feel better. Thank you.
Off the top of my head, I don't want to say with certainty whether they do or do not. I will say that in a lot of circumstances, somebody who's out on paid leave is also going to be out on FMLA, and that would require continuation of health insurance benefits. So the way these leaves generally work is that the person who's out is not getting paid, but at least has their health insurance continuing.
Thank you. So I don't know, for Emily's question, I did have another point that I don't think is for the actuaries though, but I would think that we would want to require the leave be able to be used continuously or intermittently. It's probably a standard component.
Yeah.
And I think most of the plans that we work with in other states, employees can choose to supplement with earned time rather than that resulting in an offset to the state benefit, which I think is important, especially if you are, filling 80% of a person's wages or something less than 100%.
I think so. I don't know if anyone has anything on that.
I'll just say that's a huge conversation. I mean, that could be its own 3-hour conversation. But yeah.
Thank you.
Thanks.
Commissioner?
So getting back to Emily's question about workers who don't have the appropriate documentation, since this is a work benefit, I think people need to be work authorized in order to be eligible for it. Many of the laws that we enforce at wage and hour, it doesn't matter if somebody's working, doesn't matter what their status is, they're required to be paid. I think this gets much trickier since they're going to be paying in through a payroll tax. So if you've got a payroll tax, they should be filling out I-9s and be work authorized. But I think it's an interesting question that we should think through.
Yeah, I defer to you, Commissioner, on that one. You live with the rules and regulations on this all day long, but yeah, it's an important point. On that note, seeing any other items for the actuarial study? I mean, I think they'll do this anyways, but I would just say anything else we forgot to the actuarial study, please let us know if there's something in the fiscal reality and solvency of this that we didn't consider, or is there a question that we've not asked that can have very real ramifications on this fund? So. Okay, I'm seeing the brain drain happening on the Zoom squares. So Colleen and Anna, I don't know if it's helpful to just go back over the questions, or do you have everything you need, or is there anything from us on those recommendations that we've accrued to be able to move forward?
I think we have everything we need. I mean, we could quickly go back over them, I think, if it would be helpful to what you've decided. If you wanted to, it's up to you.
My only thought is, in the interest of time, since we are about
Yeah.
we're thinking, would it be possible to get it emailed out?
Absolutely. Yep.
The commission look over it instead of having you take the time right now.
Oh, yeah. Yeah, no, it makes sense. And then I think it's a good segue to talk about the last item on the agenda, which I think Anna's going to talk about, which will also need to send something out for your review about sort of summarizing your work and then including any other recommendations about your future existence.
Perfect. I don't know, Anna, do you want to kick it off, or do you want me to sort of explain the wall we're coming up against and potential solutions?
It's up to you how you want to approach it. I just think, you're distinguishing between the recommendations that you're making on the program to the actuarial and then the recommendations you're actually making to the legislature. I do just want to point out that the way that the resolve is written is that the report is presented to the second regular session. In other words, it doesn't actually specify labor and housing. So that's a little weird. But it doesn't mean you can't report to the Labor and Housing Committee and then they can choose to report out a bill. It just means that you potentially have other committees that you could do this with. But it's just a matter of how you want to go about this. I mean, we're obviously hearing you've been talking about this from the beginning about the need to renew the commission so that you can finish the work, and that's the recommendation we're sort of hearing about. So that's where we want to start.
Okay. I think I'll jump in, and then Representative Cloutier, I'll pass it over to you. And then Anna, please feel free to jump in on anything we forget. But we're all sitting here, it's January. From the first meeting, we're all pretty clear about what a tight timeline we have, and also how something like this needs to be done carefully, deliberatively, and with concrete data that we'd be hoping to get from this actuarial study. So my co-chair and I were trying to think of ways that we can do that within the parameters of our authorizing legislation. So one idea that we've been considering, because I mean, all the questions we brought up today, I would hope and assume that all the members of this commission would like to review that data before, we make either concrete recommendations or generalized recommendations that we send back to the legislature. So one of the ideas we were thinking about was creating a report, sort of reviewing what we've done thus far. The subcommittee will be meeting and taking the recommendations we just discussed, and that we'll, all sign off on via email in the coming days. We'll be picking that actuarial vendor, having them pitch us, and then sending it to them. And then this is the sort of area that we're trying to find out from that vendor what they think they need the time. And I think that's the most important part of the work we're doing here is we need those answers. We need that data. We need that costing. And I think that's going to be really the big determining factor on when things come back. So what we were thinking, looking at within the joint rules, we could present a report like this, showing, sort of the interim review of what we've done thus far, and give it to the Labor and Housing Committee, I would assume, despite what the authorizing legislation says. And then ask the Legislative Council or the Committee of Jurisdiction for sort of an extension or a new bill that would basically give us the permission to meet again as a commission to review the study, to then turn around and give the recommendations. And we think that's a way to make sure that we are taking the time and not rushing anything and getting the answers we need. And Representative Cloutier, I'll pass it over to you to add anything that I forgot in, and also sort of share how we got to that point.
Thanks, Senator Daughtry. So I think everything you said is on point. I think that everyone here would agree that the process here is really important, and that we are deliberative about it, and that we're not sort of trying to rush through this to meet a deadline that's in a piece of legislation, but also understanding that, we are in the midst of a pandemic, and this kind of program is really, really important to folks right now. We don't want to sort of put it off any longer. So I think everything that you just said is right on. I think that, there's a lot, I think, for the actuarial study to sort of, figure out and put in front of us. None of us here know how long that's going to take. I think we did a great job today in terms of narrowing down kind of what our request is in some instances, and maybe not so much in others. But again, I think to really come up with the best program that we possibly can, that has a price tag that we can afford. So am I am I forgetting anything?
Yeah.
Okay.
Anna, Colleen, did we forget anything? So I guess our question would be to the commission members, does this sound something reasonable? Is this something that sort of fits within parameters? I mean, Representative Stearns, you're also a part of this world of knowing what it's like for report backs and things like that within the second regular session. So just sort of would kick it over to the commission members to sort of see what you think, or
I would say I'm fine with it. My question being outside the legislature is how likely is it that they would accept this recommendation?
I mean, I would hope likely. We'll make
Okay.
But I will look at Representative Stearns, Representative Cloutier, and Senator Rosen, that we will put on our best, report back and be like, because I think anyone who's watched any of these meetings or who looks at any of the materials will see how hard we've all been working, and that this isn't a quick fix, that this is something that's slow and deliberative. And then would also defer to all the commission members that part of this process is you are also more than welcome to reach out to folks when this is being considered to talk about the work you've done and the process and why we need a little more time.
Okay.
I mean, I would just add that I think every one of our colleagues is going to be interested in what the price tag is on this. And so, granting us an extension to get that, I think is a reasonable request.
Agreed. Representative Stearns?
I think it's going to take more time than perhaps we think. You need to remember that the vast majority of legislators, even though I've tried to inform my caucus, have no clue of the work that's being done and what's happening in the background. They have many, many things on their plate in their own little domain. And I worry about trying to rush something. So whatever the time is, we need to be aggressive and keep the push on. But by the end of April, it's going to be a tough lift, my opinion.
I think absolutely right, Representative Stearns. And I think that's where I think we would defer to either Colleen or Anna, or maybe this is something my co-chair and I can ask, the revisor's office, but a way to say that the time to give us that flexibility and have it based off of what the actuarial study tells us. And
I think what you're asking for is renewing this commission in the next interim, because you would be doing the actuarial study for however long, we don't know how long that would take yet. But if you're wanting the Legislative Council, which means us, to staff it, then you'd be doing it in the interim anyway. And I think what you're saying is that you would be looking for the same membership, perhaps, which you can't guarantee, but you can sort of request it. The membership would look the same, but that doesn't mean the people are necessarily the same. But that you would be asking for another resolve that would renew this to look at the actuarial study with presumably a similar number of meetings or whatever. And there's a standard reporting date, which I always forget what it is, Colleen, but it's like just before the election, right? It's just before the election, so that it comes back to this legislature, but really it's the next legislature that will determine what might come out of that study. So I think that's what you're asking for. I just want to make sure that that's what you're looking for.
I think so. I know vague terms don't work well when you're writing authorizing legislation, but it's like, I think that's the biggest thing, and time based off of that study. So
right. The clarification is just that it would be in the next interim.
I think so.
Yeah.
Okay. Strong feelings otherwise.
Well, and then you would need outside staffing if you were doing it during session. And then once you've just made sure that you're all signed off on that, is whether you have any other recommendations or whether that is the recommendation for the legislature.
Oh, that's a good reminder. So I guess, that would be the question to the commission is, would our recommendation, obviously there's a review of the work we've done, but the recommendation is we need a little more time, which I think is where I would be at as well. Is there anyone who has a different way to phrase that, or disagrees, or have strong feelings one way or the other?
Yeah, it's Barbara, and I don't disagree at all, but I think what I was hearing Anna just say is that we wouldn't have any staff support during the session. we really, if we're going to come back and do work with the actuarial study, will have to be after the session. Am I correct?
Yeah, I don't know if you remember when we opened it up, one of the pitfalls that we're coming up against is the rule that governs Colleen and Anna's department of doing staffing that's outside of the committee during the jurisdiction. And you can get, like, for example, they've had permission to be able to staff this, but that's one of the other factors that we're running up against.
Yeah.
And it may be that there's a, I don't know how long actuarial studies take, but it may be that there's sort of a distinction without a difference, in the sense that if it's going to take 3 or 4 months to do it, then you're going to end up in the interim anyway. And it's not like it's going out tomorrow. And, you still have to determine who's going to be the actuarial and go through the process of actually issuing that contract. So all of that will take time. So it may be that it, is a distinction without a difference, that it's going to take that long anyway.
I guess my thought on this is, we go through a deliberative process, we get the actual study, we're supposed to come out of that with a recommendation to a committee for a bill. And I think this is correct. I think it's the right thing to do, is that we're not going to be in a position to do that until the next session. So there will be no bill to the next session. I'm thinking about what Kristen's saying, and that we need, people need this kind of support now. But I think we have to have the right bill. I think we have to do the best bill we can that can pass. And so now I'm understanding. And I just didn't have a sense of that before. It's going to be next session.
And even after it's passed, then there's probably a year or so of funding before anyone can actually draw on it. So it's really 2+ years away, right?
I mean,
And there's also time for all the devil in the details, the rules, and all that stuff that takes time as well. Yeah.
One of the nice things about authorizing legislation is, luckily, it didn't say you have to come back with a completely fine-tuned plan for implementing PFML in the state of Maine. So I think we do have that sort of backing us up when we make that request. But I think, magically, if we got the actuarial study back in a month, maybe we'll be checking in with everyone to do sort of a different process. But I think, we are, time is needed, I guess, is the way to go. And I think the other thing would be really great, like all the materials of everything we're going through. And I think we can do a really great job of reporting back, of showing what's been done so far and the really exciting things that need to be done carefully moving forward.
And if we look at like what happened in Washington, they started their work in, I think it was 2007. So compared to that timeline, 2 years from now is like lightning speed. So
I think in anyone's timelines, the last 2 years have been both lightning speed and tortoise pace. But yes. So I'm seeing pretty much general agreement. So I'd say sort of the next steps for us would be, we're going to get the write-ups of sort of our general recommendations for the actuarial study that Colleen and Anna will send out to all of us, that please, keep a lookout to that so we can all approve that and get that moving. The subcommittee will meet. And then I guess probably the next step would be that we'd send or invite folks to watch as sort of maybe when we have those 2 firms that the subcommittee has sort of narrowed it down, to sort of hear that and then get that RFP going, and then have the report back of our adventures thus far to the Labor and Housing Committee, as well as my co-chair and I can start the process of creating a bill to ask for the extension that we just discussed, to enable us to continue our work and have that be our big recommendation, in addition to the review of we need more time. Okay. I'm seeing nodding. Is there anything we've forgotten? We have wiped out Representative Stearns. He is ready for a nap. Well,
No, I don't think you've forgotten anything. No one objects to what you just said, just following along what Representative Stearns was doing. If there's no objection, then I don't think you need to take a formal vote or anything. So we'll just go with that.
well, Representative Cloutier, before we adjourn, I'll kick it over to you to make some comments and then we'll wrap up.
So I just want to thank you, Senator Daughtry, for being like such a fearless leader over this very short time frame and sort of guiding us along. And then just thanks to all of the commission members, because I know that this has been a fast and furious 6 meetings. And I'm just really, really proud of the work that we've been able to do, and thankful to be in the work with all of you.
Thank you. And I'm going to echo everything Representative Cloutier said, and I'm like feeling myself getting like really choked up and emotional right now. So please be patient with me, but this has been an absolute dream. I have literally been wanting to do this work since I was 25 years old. And I know everyone on this call has their own story that are even longer, and we all have our different paths. And I'm so proud of this work. I'm so proud of all of you. And I'm going to leave it there so I don't, start crying while talking about policy. But seriously, from the bottom of my heart, thank you, everyone. Especially, I think if we can all give some applause to our incredible analysts, Colleen and Anna, you've moved mountains to get this to be where we are now. So thank you, everyone. Keep an eye on your inboxes, and excited for the next steps. So thank you. And with that, gavel, there we go. And meeting adjourned. Thank you, everyone.
Bye.
Thank you.
Thank you.